Record high flu numbers is something we have been reporting for weeks, and this week DHEC releasing new numbers for South Carolina that continue to show an increase in already high numbers of cases and deaths. Our Nate Stanley has more on how things are and how to stay protected.
A week after Thanksgiving, and according to Dr. Jonathan Kanuka, a medical consultant at DHEC, South Carolina is seeing another bump in flu cases. According to DHEC's newest data, in the past week, there's been over 3,000 confirmed cases, bringing the season total close to 33,000.
But the levels are still very, very high. And we could see another increase in, the numbers going up or a tide going up as people are traveling. Sometimes we have one peak in a season. Sometimes we have two or three.
Kanuka notes that 80% of South Carolinians still haven't received this year's flu shot, the single best way to prevent hospitalization or death. However, if you do plan on traveling for Christmas or New Year's, he says now is the perfect time since the shot's effectiveness typically takes weeks to kick in and could save a life.
Obviously, we're concerned moving into the upcoming holidays as well, when our immunization rate is relatively low.
One organization trying to help with this year's increase is My Pharmacy, based in Lexington County, which offers drive-through COVID testing and vaccinations. Janae Fredericks is the general manager at the site on Gardners Ferry Road. She says her team operates 8 drive-through locations in the Midlands where they see 300 to 400 patients a day.
Especially with Thanksgiving going by, we had an influx of people. We are seeing positive flu.
James Chapman, who lives in Columbia, says he took a break from work today to get his flu shot. At 80 years old, he understands the risk of going unvaccinated.
I'd rather be on the safe side and be on the wrong side. I don't like being sick now. Another thing, I don't like them needles, but you got to do what you got to do.
In Columbia, Nate Stanley, News 19, WLTX.
Yes, you certainly do. And some good news, RSV cases in the state appear to be on the downward trend. The flu cases, though, taking up the majority of that viral illness here in South Carolina.